Individuals afflicted by mental illness are overrepresented within the criminal justice system. At the local level, they can be repeatedly booked and detained, resulting in a vicious cycle of regular incarceration. Using data from the Durham County Detention Facility and the Duke Health System, this Data Plus project examines patterns of health service utilization in the incarcerated population, including those with and without mental illness diagnosis. Building on research done in previous years, our team acquired 3 new years of data from 2019 to 2021 provided by DCDF and Duke Health Centers, which give us the opportunity to examine trends in more recent years and do some interesting research on the period of COVID-19 pandemic specifically. This summer, our team's primary objective was to clean and organize the data on demographics, bookings, encounters, and diagnosis in preparation for more detailed analysis during the academic year.
So the information in these data sets is protected health information. So before the beginning of this project, each team member was required to complete thorough HIPAA training and receive IRB approval. And to maintain the privacy of our data, we worked within a protected online workspace called PACE. And using a matched data set provided by the Durham County Detention Facility and the Duke Health Analytics Center of Excellence, we conducted descriptive analyses and statistical analyses of the population of interest for this project. To prepare our data sets for analysis, we first had to clean our data and discuss and address the challenges of dealing with duplicate entries, conflicting race records or sex records, etc. And after cleaning the data, we used our software to visualize our data and conduct exploratory and descriptive statistical analyses. This year, our team incorporated new mental health related variables or tags with which to subset our data. So we had a big 3 tag, which included individuals who were ever diagnosed with at least one of the following mental illnesses: schizophrenia, bipolar disorder, or major depressive disorder. And this is in academic literature categorized as an SMI tag, or a severe mental illness. And we also created a broader mental health tag, which includes individuals who were ever diagnosed with a mental disorder, including substance use disorders, anxiety, and others. These tags were created to replace the mental alert tag assigned by the DCDF, which previous teams used for their analyses, but was discontinued due to protected health information concerns. We created different sets of tables to show general demographic characteristics and information on individuals during the COVID-19 pandemic in tables 1 and 2, and various metrics of booking and incarceration status were compared for the big 3 and mental health groups in tables 3 and 4. Healthcare utilization was examined based on age and service area, and the occurrence of both substance use disorders, suicidal ideations were examined within the population with mental health diagnoses as well.
Yeah, so William, do you want to maybe zoom a little bit so people can see a broad overview of the figures? Perfect. Thank you so much. Yeah, so as Will and Maya were explaining, this summer we had access to roughly 3 more years of new DCDF and Duke Health data to analyze in conjunction with and compared to the 2014 to 2018 data. And so since these new years of data also included bookings and encounter data during the pandemic, in some sections, as you can see, we honed in specifically on how data changed from April 1st, 2020 to 2021. And as shown in the poster, we broke our analysis and visualizations down into 4 categories. The first one being demographics with 2 charts listed, bookings with 4, health utilization or encounters in the middle, and finally diagnoses, just to understand these differences and how percentages might have changed over these 7 years of data collection. In the demographic section specifically, we mainly wanted to visualize contextual information that will lay the groundwork for future research questions and also to better understand the data itself and the demographics of the people that we're working with. We also thought it would be interesting to explore the demographics breakdown of those who contracted COVID-19. With the bookings data, we gathered some information on numbers of bookings, median days of incarceration, and longest incarceration across groups, and broke that down by sex. And then in the encounter section, sorry, William, I'm making you move all over the place. Our main analysis was on healthcare utilization in Lincoln Community Health Center, the emergency department, and then in other Duke Health clinics, excluding LCHC and the ED. And then finally, in the diagnosis section below, our team looked at the breakdown of overdose types across groups, the groups being the SMI population and the non-SMI population, or big three, my bad. And then in the chart in the middle, we explored suicidal ideation rates compared to drug overdose rates. And then finally, substance abuse diagnoses by sex.
Right. So we've done all this work all summer cleaning this data, and you see these tables, but what are the main takeaways? Well, consistent with the years prior that this project has been running, we found that the overwhelming majority of people in our matched data set are Black, non-Latinx males. When looking at the individual's bookings, we see that the big three group, the group of people who have diagnoses of big three mental illnesses, see longer median incarceration times and also a higher number of bookings and longer lengths of maximum incarceration times. If we look closer at sex differences for bookings, we see that the percentage of the incarcerated female population that have been diagnosed with a big three mental illness is nearly double that of the percentage of incarcerated males with a big three diagnosis. However, the male population generally always has more average bookings and a longer length of incarceration than females. When we're looking at Duke Health utilization, we find that both the mental health group and the big three groups utilize the emergency department more frequently and the Duke Health services in general more frequently, with the big three group having the most emergency department encounters. When looking at substance abuse, we found that a larger percentage of individuals in the mental health group have mental health related diagnoses for drug and alcohol use disorders. And then when looking at sex, we find that almost all mental health and substance use diagnoses are more prevalent among the female incarcerated population than the males. Similarly, when we're looking at suicidal ideation and overdose diagnoses, we find that the group that have been diagnosed with a big three mental health disorder are much more likely to experience suicidal ideations and or overdose on potentially life-threatening drugs. So really moving forward, we're lucky enough to continue this project as a Bass Connections team during the academic year. And we're going to continue research on the impact of mental health and mental illness on rates of recidivism. With our new data that's all cleaned now, we're excited to look at COVID numbers, how the justice system was functioning during the pandemic. And also in the middle of 2019, the Durham County District Attorney introduced a new innovative system for cash bail. And so we plan to look at that and share all of our data with our stakeholders. So I'd just like to say thank you for your attention. And I know we covered things very quickly. If you have any more questions about specific figures or methodology, please don't hesitate to ask.
So thank you all. This is some really complex work and very well presented. Folks, go ahead and unmute yourself, ask questions, or put them in the chat as you like. So I guess I'll ask, like, are you actually in contact with DA DeBerry on moving forward, or is this, or like, do you have a sense of like what it would look like to do before afters on the bail question?
I can answer that one. Actually, I've talked to I want to say Siegel was his name, who's DA DeBerry's policy assistant, and had a long conversation with him. And short answer is yes, they are very interested in having some kind of empirical analysis. we haven't gotten into the detail of like describing and planning how we're going to do the analysis with them, but they are generally on board and we are generally in contact. So yeah.
Cool. Interesting. Do you know, I mean, this is inside baseball, but have you ever made contact with Ryan Smith or know who he is?
I have met him briefly, and yes.
Okay, yeah, he helps run the innovation team. He's also now, I think, in charge of setting up that new sort of community safety department. And so I think he's a good nexus for sort of lots of connections.
Yep. Thank you for reminding me about him. Good call.
Other questions? So I guess I've asked this in a few groups, but just to get you all talking. We've heard a lot about sort of the technical stuff you've all done, which is very impressive. You know, often when you go for job interviews in data science, they're also interested in kind of getting a sense of your journey, like what you didn't know beforehand, how you got to know it, what was hard. Anyone feel like sharing just how they got from point A to point B? Like what was bewildering, what was easy, what you learned?
I can definitely say that I learned a very large amount of new information. I definitely started at square one, and now I feel pretty confident just thinking about what I want to find in my head and then being able to write code in order to get those numbers, which I never thought I'd be able to reach that point. So that's been very exciting for me. I think, honestly, our biggest challenge, Maya and I can probably both say this, is that our RStudio crashed very frequently. I think it's because we were working with so much data with 5 million rows and a couple of files that all had that same amount of rows. And so it was difficult. So we definitely gained some resilience by going through this, but I'm very excited about the progress that all of us made.
Yeah, I would definitely have to agree. I think I learned a lot about how RStudio works and also how to be a little bit, just try to be problem solving on my own. If something didn't work, I had to look things up or figure things out, which was definitely different than the statistics class I'd taken before. It was a different experience. And I think it was really valuable because it helped me learn a little bit more about how to like work with data in the real world. And like, if there's a code that you really can't figure out, how to go about using other code to bounce off of, or like finding a different way to go about things. And I think about the criminal justice system in general too. I think the conversations we had and our book club where we read this book called Halfway Home about the criminal justice system, those were really valuable to me. I think we had a lot of really important discussions, and it just put a lot of context behind the work we were doing, and really like grounded us and like helped us, see like how important the work we were doing actually was.
Thank you.
Yeah, and for me, kind of sharing my perspective on point A to point B, I kind of started off like all I know about like mental health and criminal justice system. A lot of it just kind of the traditional perception like you got from pop culture or things like that. And also like to be very honest, like when one program just started, right? It's very, I feel like it's more on the technical side, like a lot of data cleaning. But I feel like it's kind of towards the second half when we actually start to get those charts and see the numbers and get to actually compare them. Then you realize, wow, like you see those data, even though some of those you kind of guess that from the very beginning. But when you actually see the numbers, and some numbers are surprisingly high or surprisingly low, I think that's when you see that these are the actual like data that like this is the reality that people are living instead of whatever the pop culture is kind of depicting.
That's very interesting.
Yeah, I think my main takeaway is how collaborative data science can be, and just bouncing ideas off of my peers, my team members, and also our project leads, and really finding out some hidden variables that we weren't thinking about and why certain numbers don't match up together. Because if you just did this project alone, how many times did we have to go back and debug stuff because we were double checking each other the entire time? So we would have totally different numbers if all of us did this exact same project by ourselves. So I really liked the collaboration and being able to have the support system that my awesome peers have set up for me.
Cool. So I think we can wrap in a few minutes. We tend to have a little bit of passing time before the next one. Anything anyone else wants to add, or?
I'll just say,
Thank
thanks
you
ag-
for this experience, and I really enjoyed the summer and getting to know everyone, and I'm so looking forward to what we discover this year and working on this project further. It's been a
It's like
really incredible experience.
Y'all are all going through in the past, right?
Yep.
Oh, that's awesome.
Yeah, thank you, Paul, for another great summer of, doing this remotely. And I know it's not easy, but hopefully next year we'll be in person. But
Yeah, I feel like
you
I
guys
have
run a
the,
great ship.
it's like the, I don't want to say the least fun, but it's definitely the thing that's hardest to do remotely is my role, just because I love walking
Yeah.
around Gross Hall,
Yep.
But
Yep.
yeah, we're planning on an expo in either the fall or the spring, just to sort of bring us all back in person, externalities permitting. So
Yep. That would be great.
all right, I'll stop recording here.